or intolerance to heat and cold. He denies any history of frothy urine or hematuria or any blood in his urine. He also doesn't report any abdominal or flank pain. There is no history of any recurrent diarrheas or constipation or any change in his GI symptoms. His biopsy was also done in 2021, and other investigations such as ANA and dsDNA were also done. According to the patient, his life has been moderately affected by this disease. He doesn't have any family history of such disease. His socioeconomic status is satisfactory. He can afford his medications. His father is a taxi driver. They own their house, and although his older brothers are also working. There is no significant past medical or surgical history. He denies any history of any addictions. The patient has been taken steroids on and off before and continuously for the last 3 years in varying doses. Currently he is on 6 tablets OD. He does not, apart from the weight gain, he does not report any complication of steroid intake such as stry, any muscle weakness or any easy bruisability and such changes. He's also taking HCQ for the last 2 years in varying doses, and currently he is on 200 milligram BD. He doesn't report any visual changes associated with these. He has also been taking azathioprine for the last 3 years, and also he took 2 injections of rituximab 6 months back, but according to the patient, his disease doesn't appear to improve with these injections, and he doesn't plan on continuing these medications. Now moving towards the examination. On examination, there's a young man of average height and build, lying comfortably in the bed and shows no signs of apparent distress. On general physical examination was completely normal. His blood pressure was 110/70. His pulse was 76 beats per minute. He was currently afebrile, and respiratory rate was 16. Now the cutaneous examination. On examination of the hands, on the nails there is longitudinal ridging involving almost all of the nails with dystrophy of the middle nail of the right finger. There is also periungual erythema and telangiectasias involving all the digits of the hands and feet. There is also slight joint deformity, slight ulnar radiation of the distal interphalangeal joints of the little fingers of both hands. Some hypopigmentation is also noted on the skin of the interphalangeal joints. There are multiple atrophic hypopigmented plaques on the dorsum of the hands. On the palmar aspects, there are erythematous patches with a slight scaling as well. Now, there are multiple ill-defined erythematous plaques on the forearm, the chest and the neck. There is loosely adherent whitish scale, and multiple areas of hypo and hyperpigmentation, and some atrophy and scarring is noted as well. Now moving towards the face. On the scalp, there is on the examination of the scalp, there is some loose white scale, and the ears there is follicular plugging. Schuster sign is positive. Also on the external ear, multiple telangiectasias are noted. On examination of the face, there are well-defined erythematous atrophic plaque almost involving the entire face with relative sparing of the sides of the forehead and the periorbital region. There is whitish loose adherent scale and multiple areas of hyperpigmentation, and some scarring as well. On examination of the back, there is a large well-defined plaque almost about 15 cm in size with hyperpigmented borders, loose scale, and there is central atrophy. Plaques of smaller plaques of similar morphology are spread around this large plaque on the lower back as well. The lower limb examination. The rest of the lower limb examination is normal except for the feet. There are on the plantar aspect of the feet, there are hyperkeratotic erythematous scaly plaques involving the entire plantar surface. The nails of the feet also have periungual erythema telangiectasia, and there is also a longitudinal striations in these nails. The systemic examination was unremarkable. On the systemic examination, the cardiovascular, respiratory and neurological examination was normal. On the musculoskeletal examination, the Gauss sign was negative. On the prayer and inverse prayer sign, the patient had some pain, and there was also lateral deviation of the proximal interphalangeal joints of the little finger of both hands. Based on my history and examination, my differential diagnoses are systemic lupus erythematosus and disseminated lupus erythematosus.